Good day, friends of Uzzy. Well, everyone is all a Twitter right now about what the timeline is of President Trump's acquisition of coronavirus. Much of what we know about the downstream side is going to be perplexing from a symptom standpoint because the medication cocktail he got is unique in all the world. However, we can tell a lot about the duration of expected coronavirus and see what is superimposed on what we know. Today, we're going to talk about the timeline of acquisition based on other people around the president who became ill. We're going to talk about what is expected in normal coronavirus symptomatology and treatment, and then we're going to talk about what to expect for the next few days. This will be interesting for anybody looking at this mid-October or later, because today is October 7th. And so if there's anything interesting that's going to happen, it's going to be in the next few days. And so if there are concerning developments, you'll probably already know it by the time you watch this. So limited shelf life, Pain Care Labs, coronavirus timeline, here we go. The interesting thing about coronavirus is that it takes so long for the SARS-CoV-2 virus to invade the nasal ciliated epithelia and then have a chance to fuse with the cells and then replicate and move forward. So when someone is exposed, whether it's a super spreader event or over time, they have a slow progression to when they develop symptoms, and then a slow progression to when they get into trouble with their lungs if they're going to. So the usual progression on average is that it is not a slow accumulation over time. Most people, we now believe, get coronavirus from a super spreader event. A super spreader event is one in which 80% of people are going to catch it from about 20% of infectious people. Interesting new news, it turns out that the likelihood of being a super spreader in which you exhale so much viral load at one time that people who are around you for even 15 minutes in an enclosed space can get it, chances of being a super spreader are higher the older you are, the fatter you are, and or the more obese you are, and the louder you're speaking. In addition, the chances of being a super spreader increase when you have any kind of respiratory illness. So those characteristics are the hallmarks of a person who is super spreading. Now, what we also know is that you tend to be most likely to spread the virus in the first 2 days before you're symptomatic and the first day you're symptomatic. In general, you develop symptoms about day 5, 6 when you have coronavirus or COVID-19. And in general, you don't start getting severe pulmonary issues until day 12. And there aren't, well, pulmonary issues, and then the immune system issues don't really hit until day 15 to 20. So that's the reason why the death toll lags about 3 weeks after people are diagnosed. So the cases come most of the time when someone has just started having symptoms, and then a week later they get acutely worse, and a week later they've got the immune system issues. So let's back this up. What we know is that President Trump was having symptoms on Wednesday, that he was feeling more fatigued, that his voice was more raspy. Hope Hicks came down with coronavirus, with COVID-19, and a positive test on Wednesday night. Most likely, they were exposed at the same time, or it's also possible that Trump would be more likely to be a super spreader than Hope Hicks. So it's possible that she got a big viral load from him early on and developed symptoms faster. Given the fact that so many people, I think it's up to 9 now, who were at the Rose Garden event on September 26th, became COVID positive, most likely that was the super spreader event at which Trump also would have caught the virus. So moving forward to Wednesday, Thursday, this means that if symptoms started Wednesday and Thursday for President Trump, which they did, then that means he was most contagious on halfway through Monday, Tuesday, Wednesday. So it certainly is possible that there were people exposed at the presidential debates. And the incubation period for how long it takes to start showing coronavirus or to test positive is up to 14 days. Now, by 14 days, 99.8% of people who are going to show symptoms have showed them. Most people, again, on average, are going to show them on day 5 to 7. So the most likely time frame still fits this concept of starting to have some symptoms on Wednesday, Thursday. That's probably day 4, 5, 6. And that would mean that when he went into the hospital on Friday, that's on the 6th to 7th day. Now, there's a lot of questions about when were the positive tests, because that has implications about ethics and it has implications about other people being ill. I'm not going to touch that. What I am going to say is now let's talk about the medications. So there's a great protocol by Dr. Marik at Eastern Virginia Medical School that has Famotidine, which is Pepsid, which also behaves as an antiviral as well as an antacid. Melatonin, which is an antiviral, often taken at night for sleep. Zinc, vitamin C, and vitamin D. All of these things Trump got early on. So that was sort of starting this EVMS protocol. But then the first medication, and probably the one that makes the most difference, is the, I believe, $10,000 a pop, or $100,000. It's the monoclonal antibodies. So when your immune system is gearing up to fight a disease, you make antibodies that directly grab onto the virus and neutralize it. So what he got early on was a big dose of antibodies that have been developed specifically to attack the SARS-CoV-2 virus. Most likely, that's the biggest thing that made a difference, because it's early in the trials. We haven't seen results from it. I think he's the 5th person who got it. But the Remdesivir, which is an antiviral and it stops the replication, that hasn't been showing as much help. Probably the reason Remdesivir is not as effective for coronavirus is because most of the replication of coronavirus goes on inside the cell and spreads laterally to other cells. They make these tiny little micropodi, these little knives that slice into the next cell, and that's where they go through. So there's not an easy bloodstream way for an antiviral medication to have a chance to stop the replication of coronavirus. On the other hand, having direct antibodies that can neutralize it when it does come out, that is much more likely to be effective. So he got the dose of monoclonal antibodies, and symptoms persisted for about 2 more days until Monday, and today, Wednesday the 7th, supposedly symptoms have been gone for 24 hours. So here is the thing about what to expect going forward. First of all, he also got dexamethasone. Now, dexamethasone is a glucocorticoid, it's a steroid, and it has the effect on your immune system of dumping a Chinook helicopter's worth of water on a forest fire. So as your immune system is trying to kindle and build up some smoke, which are the antibodies that can be released, if you get Decadron, you're going to crush that flat like a bug. Now, that's great if the problem is going to be your immune system. Not so good if you actually still need to do some fighting of the virus. So here's where the issue is going to be. It's really going to be the 9th, 10th, 11th. Because the 9th, 10th, 11th are going to be roughly the 12th through the 13th and 14th days. And if you look at the schematic, what you can see is that typically you don't have very severe symptoms up until day 10, 11. You start to get severe pulmonary or lung symptoms around day 12 to 19, and that's when the immune system overreacting becomes a problem. So another fun aspect about steroids and Decadron, when we give them to patients, they will do several interesting different things. Sometimes they get a steroid-induced mania. They don't sleep. They're very grandiose. They are extraordinarily impulsive. It's kind of like giving Adderall to somebody who doesn't need Adderall. They're intense. The other thing that steroids can do is cause poor judgment. It can cause a phenomenal appetite, or it can cause people not to be hungry at all. Usually it's more the eating thing, and it can also make them very irritable. angry, volatile. One person said their child got steroids and they turned into the exorcist. So head spinning, your mileage may vary, but no question, steroids make you feel pumped for a lot of days. So when you have steroids on board early with coronavirus, the data has shown that you actually have about 12% more chance of dying when it's given and the person is not on continuous oxygen than when it is. No clue what's going to happen here because we've got so many competing and different medications that it's hard to know. But if the course of the illness were running in an uninterrupted fashion, if it were behaving like the normal characteristics of coronavirus, there would start to be some severe pulmonary issues and dropping oxygen saturation Friday, Saturday, Sunday of the 9th and 11th of October. Hopefully, there are no further symptoms and the medication is going to be able to be studied going forward, and the monoclonal antibodies have behaved really differently from any other drug that we've tried. So it's a huge boost and it's very exciting if he stays well and it's monoclonal antibodies that are likely to be supported. We've tested steroids so many different ways, so many different times. Guarantee you, taking Decadron early in the course is not going to be the move here. If anything's going to happen, we know a lot about Remdesivir. We know Decadron's great late in the course, but this is a really huge boost for monoclonal antibodies. In addition to the problems if he does get sick again for President Trump, the big issue is, a big issue for the rest of the country is we no longer know what to make of that monoclonal antibody situation. And they're going to have to exclude him as a patient in the studies because there's too much else going on that's unknown that can change variables. So it will make it more difficult to feel relief that we've got something that can help protect our loved ones and keep them alive if they have to go in the hospital. All of that said, the interesting things that we've learned from this, it's not a good idea to treat people atypically because you end up in a situation where you really don't know what's going to happen. We do know that you're contagious and you should avoid people for until 10 days after your last symptoms. So assuming President Trump is asymptomatic and has been since Monday, that would mean that he should not be around anybody else until the 14th. That's also coincidentally about when we will know that Biden has reached the end of the time period that he's at risk for having been exposed to Trump on the debate night on Tuesday. One final thing that I would really like to emphasize for all of my fellow frontline emergency doctors, ICU doctors, primary care doctors, please, if you're a patient, do not ask for special treatment. Do not ask for a drug that hasn't been tested yet. I know how frustrating it is to know that the President of the United States got access to a medication that could have saved his life and could save your family's life, but you're not going to get it. Don't bug the doctors about this. They can't get monoclonal antibodies on a compassionate use basis. We don't know for sure they help. We certainly don't know that Remdesivir or early Decadron have helped. And it has caused a lot of harm and a lot of extra stress for our frontline doctors and nurses who are being badgered by desperate patients. So it's really hard to say this, but please have faith in the process. Most patients are being treated with the absolute best data we have and with the absolute best treatments that we know. And until we know for sure it's going to help, we don't want to run into a hydroxychloroquine when you can actually kill people with cardiac arrhythmias. We don't want to run into a place where people are getting Decadron early and then their immune system is completely shot and they can't fight off phase 2 when it hits. So trust your doctors and nurses, and please don't try to get any of these special drugs at home. They shouldn't have been given when they were. I hope they work. With that said, we've got lots of other videos about the mechanisms behind Famotidine, all of the different medicines and vitamins and immune boosters you can take at home. There are no proven immune boosting products that are on the market. So do not spend money on anybody who says they've got a cure. Everything that has good data behind it is found in your local grocery store and is easy to get, with the possible exception of quercetin, which is a bioflavonoid found in fruits and things. Regardless, we've got videos about them. You can see our other videos, check them out, and what an interesting 7 days it's going to be between now and the next time I give my updates. And until then, big breath, y'all. It's going to be fine.